You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Good evening to our dear viewers. Thank you for keeping it at DOCtalk Show. This is yet another edition of DOCtalk Show where we talk about health challenges that people are facing in the community and how best we can prevent them. My name is Dr. Alex Lwesabula, and I'm going to be your host tonight. This show airs out every Thursday at 9 p.m. So keep it at DOCtalk Show every Thursday so that you get health workers talking about the different health conditions and how best you can prevent them. This show is proudly sponsored by Ministry of Health of Uganda and Kamara Men's Collections, which provides suits. Check out on them. If you have any function, graduation parties, and all kinds of parties, check out on them, and so that we always bring you these sessions. Today our topic is going to be diabetes mellitus. This is a condition that was formerly known to be the disease of the rich, but we're seeing that now it's affecting people of low and middle income status. So I have our very own medical doctors that we're going to be delving into this topic with. Allow me to give a chance to our panelists to briefly introduce themselves so that and then we go deep into the discussion. Dr. Henry.
Thank you very much, Dr. Alex, for that introduction. Good evening, our beloved viewers. Thank you very much for being part of this show. Like rightly introduced, my name is Dr. Ssekyanzi Henry. I'm super happy to be here to talk about this topic that I'm very passionate about.
Thank you so much. Dr. Kamara.
Thank you. My name is Dr. Kamara Ivan. I'm a medical doctor at Mulago Hospital. Thank you for having me and thank you for joining us.
Yeah, sure. Thank you so much, our panelists, for that introduction. Allow us to go deep into the discussion. We are going to start with understanding what exactly diabetes mellitus is, because people don't know what exactly diabetes mellitus is, and you find people describing it in their own ways, and because they describe it in their own ways, of course, it comes up with so many challenges in seeking treatment and everything. So let's start with the introduction of what exactly diabetes mellitus is, and I want to call upon Dr. Kamara to give us the introduction of what diabetes mellitus is.
So let's start by understanding what diabetes is. So diabetes is a medical condition in which your body either does not produce insulin or it cannot effectively use the insulin that it's producing to manage your blood sugar levels. So normally in our body, we have a hormone called insulin that regulates our blood sugar levels. So say after you've had a meal, your blood sugar level starts to rise, and then a hormone is produced called insulin that comes in and helps that blood sugar to be taken up into the cells and the excess to be stored. So when you have diabetes, this hormone is either not being produced or it's being produced, but your body has lost the ability to use it effectively. We say it has developed resistance to the hormone. So that's what diabetes is. So there are different types of diabetes, which Dr. Henry will tell us about. So there's type 1, type 2 gestational diabetes.
Thank you so much, Dr. Kamara, for that detailed description of what exactly diabetes is. At this point, I request us to go deep into the different types of diabetes as she expounded on them. Dr. Ssekyanzi is going to take us deep on what exactly those types are and what exactly causes them. Dr. Ssekyanzi, back to you on the types.
Well, as Dr. Kamara rightly put it, basically it depends, everything depends about this insulin, that the types are actually quite many. Up to 5 types, but they are quite, the most common ones are 3 types. That's type 1 diabetes mellitus, type 2, and the gestational. The others, maybe we shall discuss about them another time. So starting with diabetes mellitus type 1, is the one that happens when the body or the pancreas does not produce enough insulin. And this is the commonest type in the children. So much as we used to think that diabetes is the disease of the elderly people or maybe the disease of the rich, diabetes can actually affect the children. And there's quite a number of young children out there who have diabetes. And for these children, for them, most of the times it's type 1, whereby their pancreas does not produce this hormone insulin.
So, doctor, can we maybe just ask a question? Can we call this type 1 diabetes the disease of the young, the diabetes of the young?
Actually, I think we can actually call it that because it's mostly the young children. However, that doesn't mean that adults don't get it. Adults as well can get it. However, most of the times in the young children, it's type 1 diabetes. Then the type 2 is
and I think it's the so-called early onset type of diabetes.
Early onset, because it starts quite early when most of the times people are still young. Then type 2 diabetes, this is the commonest in with the adults, especially people who are a little bit advanced in age and those who have the risk factors, as we shall talk about them later. So in this type 2 diabetes, the insulin is there. The pancreas is producing the insulin in adequate amounts. However, this insulin is not doing its role. So there's sort of ineffectiveness in the way insulin works. Ideally, this insulin acts as a key to help this glucose enter into the cells and so that it can be utilized. However, what happens in type 2 diabetes, you realize that this key is no longer effective, is no longer opening the cells to allow the glucose to enter the cells, and that's what you call insulin resistance type diabetes. So this type is the commonest in people who are advanced in age, and it's established that over 90% of the population have this type of diabetes. Yes.
Okay, thank you so much, Dr. Henry. I request, if possible, you take us through just briefly what gestation diabetes is.
So whenever you hear the word gestation, it means pregnancy. So this is the a type of diabetes that happens for the first time when people are pregnant. There are quite a number of other medical conditions that will come in pregnancy. There are things like gestation hypertension. Gestation diabetes is also one of them. So someone can actually be normal and they're having their glucose levels well controlled, but when they get pregnant, they get to see their blood sugar levels rising, and we call this gestational diabetes.
Okay, thank you so much, doctor, for that detailed description of the types of diabetes. Maybe I request to inquire from you. So is it important to know which exact type of diabetes I have? Is it very important? Does it change the management a bit, or it's not important?
Yeah, that's a very wonderful question, Dr. Alex. So realize that depending on the type of diabetes that a person has, the treatment also follows the type of diabetes. So for instance, if somebody has type 1 diabetes where the body does not have enough insulin, for them, the medication would actually be to give them insulin.
To give them insulin that they don't produce.
Yes. Then for type 2 diabetes, the treatment actually also varies. So it's quite important for us to know which type of diabetes someone has so that we tailor our treatment to that.
Thank you so much, Dr. Henry, for that detailed description of the types of diabetes. As he has said, type 1 diabetes is what we call early onset diabetes that starts in the children, or that its point of initiation is childhood. And then the type 2 diabetes is the diabetes that starts in adults, most especially when the insulin is being produced, but it's not being used.
Yes. However, that doesn't mean that adults cannot have type 1 diabetes. Okay, they can have it, but the proportions.
So you can have these types like cross-cutting different age groups. Okay. Thank you so much, doctor, for that clarification. I request to go to the signs and symptoms of diabetes. What makes me think that maybe I have diabetes, depending on these symptoms that I'm having? What tells me to think that maybe this could be diabetes? I'll begin with Dr. Henry.
Yes, thank you very much. So the signs and symptoms are going to arise simply because someone has a very, very high blood sugar levels. And mainly, one of the things that usually come first will be increased thirst. These patients tend to drink a lot, and as well they tend to urinate a lot. Of course, there are some other symptoms that will happen like weight loss, as well as patients feeling fatigue, but most of the times it's that increased thirst, increased urination. Sometimes they can actually be increased appetite, so they tend to have what you call polyphagia. So these terms, they have other medical terms to mean them. So the increased thirst resulting into increased urination, we can say someone is having polydipsia because of too much thirst all the time, and then from that
they want to drink all the time.
So they tend to drink most of the time, and then they tend to urinate a lot, which is called polyuria.
Is it because they are drinking a lot, or there's something that is causing extensive
drinking
urination?
A lot partly contributes, but most importantly, the fact that they have a lot of sugar further complicates this polyuria, and the patient tend to urinate a lot. But of course, there are some other symptoms that may not be very specific, things like the fatigue, and the weight loss, they may not directly
That feeling
point to
of tiredness all the time.
Yes, it's quite common. And most of the times, they may not even have any symptoms actually, because diabetes is it's quite a silent killer. They usually don't have overt symptoms that show. And also, you've noticed that most of the times in our communities, patients come in with complications when the diabetes has advanced and they are having complications.
Actually, some statistics show that almost half of the people who have diabetes don't even know they have it yet. So in the beginning, it's actually asymptomatic. There are no symptoms. So when the disease is still starting and progressing in your body, you won't have symptoms. It's only when it's reached a level where your body can absolutely no longer regulate your blood sugar levels, and then you start to develop the symptoms. So most people here discover they are diabetic when they've been admitted in the hospital with very, very sick with complications. There's someone I know who was the first time she realized she was diabetic, she had come to the hospital with extreme fatigue. She had been exhausted, feeling exhausted all the time, urinating a lot and drinking a lot of water, and thought maybe she had malaria. She kept treating malaria, and then she ended up in the hospital and discovered she was diabetic. So I had to, I always tell people, a good rule of thumb is if you're going to the bathroom in the middle of the night, if you're going to the bathroom more than twice, that's not normal. You should get yourself checked out. Yes.
And sometimes the frequency, because yes, of course, sometimes peeing once in the night could be okay, but you realize that usually when you're having this diabetes, the number of frequency increases. You tend to go there more frequently. Yeah, the beauty during the day, usually most people don't notice that actually they're having this problem, but usually night time is the best time to tell, because you rest and you can always monitor. So if you see that you're actually increasing more the frequency at which you read it at night, it would be important that you have a test at least for diabetes.
At that point, allow me to pause a little bit, and I first pose a question, because you talked about the fact that people usually are diagnosed when it is very late. So, and ideally, one of the things that we always look up to is how best can we diagnose people at early stages so that we begin management early. So how frequently should I probably go for a checkup to find out whether I have diabetes or not, so that I prevent being diagnosed when it is very late, like the thing that you've talked about?
Yes, so there's something called pre-diabetes, actually. So this is a stage where your body has started to, it's failing to regulate your blood glucose levels properly. The hormone is already a bit faulty, working faulty, but you're not yet at the stage of being called diabetic. So when you go to the hospital, there are some tests they can do that show that something is already going wrong, but you're not yet diabetic. So that's what they call the pre-diabetes stage. So it's advisable to go for screening to see if you're diabetic, especially if you have a first-degree relative who has diabetes, if you're over the age of 45, or if you have the risk factors for diabetes. We shall look into which we shall look into
the next sessions.
Yes. So it's screening is very important. Like I said, there are so many people that are heading towards outright diabetes and they don't know it. There are some people already diabetic and they don't know it. So screening is advised, especially if you're over the age of 45 and you have a relative who has diabetes.
Okay. Thank you so much, Doctor, for that detailed description. We are going to go for a short commercial break, and when we come back, we shall delve deep into the complications that she has talked about. However, I request to remind you that this show is proudly sponsored by the Ministry of Health of the Government of Uganda and Kamara Men's Collection that bring you suits for all parties and weddings. Thank you so much.
This message is from the Ministry of Health with support from partners.
Since 2015, Quiz Mali Production has been at the forefront of media innovation. Our passion for storytelling and creativity has driven us to deliver over 100 successful projects, making a lasting impact on the industry. With 4 highly acclaimed TV shows, we've become a household name, bringing quality content to your screens. At Quiz Mali Production, we specialize in content creation, digital media marketing, media buying and documentaries. We plan corporate events, provide top-notch photography and videography services, and offer seamless translations and live streams for your every need. Join the hundreds of satisfied clients who trust us to bring their visions to life. Quiz Mali Production, your partner in media excellence. Visit us at Quiz Mali and let's create something amazing together.
This message is from the Ministry of Health with support from partners.
Welcome back, our dear viewers, from that short commercial break. Show. This show is sponsored by the Ministry of Health and Kamara Men's Collection, and we are at the time we went into the short commercial break, we are still talking about the complications of diabetes mellitus, because Dr. Kamara said that due to poor health behaviors of our people, they usually come when it is very late. So I want to know which complications are those that people with diabetes mellitus tend to have that at times insinuate them to come and seek care. What are those complications of diabetes, Dr. Kamara?
One of the things that people living with diabetes get is ulcers on the foot. So we call it a diabetic foot. So they are prone to getting wounds on the feet because the diabetes damages the nerves and also impairs blood flow to the feet. So they often get wounds on the feet, and these wounds are quite dangerous, more dangerous than if you didn't have diabetes, because when you have diabetes, your immunity is already very low. So those wounds are going to progress, they're going to become worse and worse. They are not easy to treat. So even if you use the antibiotics, the regular antibiotics, they may take a long time to heal. And if unfortunately it doesn't heal, it just grows bigger and bigger. It can take up the whole foot, now becomes affected. And some people even unfortunately lose their feet or maybe their leg. So that's one of the complications that people living with diabetes get. In fact, one of the things that we emphasize a lot when we are talking to people who have diabetes is foot care. So first of all, they're supposed to keep their feet very clean. Short nails, keep your nails clean. The foot must be examined every day, and even when you're washing your feet, you must wash it in detail, carefully. You must wash in between the toes, wash the heel, and there are certain shoes that are also recommended for people who have diabetes. Yes, there's a certain footwear that's preferable. Footwear that gives your foot enough, that does not compress your skin so much to further impair your blood flow.
So like the shoes should not be so tight.
Yes,
they should be a bit loose.
Yes, the shoes should not be so tight. They should be loose, and there's some types of shoes that also have a certain base that allows your foot not to be compressed.
Like the sole?
Yes.
The sole down.
Yes.
So, Dr. Kamara, you talked about something that I picked interest in, and that's examination of the foot. What are those things that I'm basically looking out for if I'm maybe showering at my place and I know that I'm diabetic? What are those things that I'm basically looking up to maybe think that I'm at risk of developing a diabetic foot, so that it does not progress, because we want to do more of the prevention? So what are those things that I'm actually looking out for?
Yes, so when if you're diabetic or you're living with someone with diabetes, when you're looking after the feet, one, you should make sure that you do not needlessly walk barefoot. So where possible, you should wear shoes to protect your feet. And then when you're examining your foot, you should look out for any change in the skin color, or look out for any areas where you feel you do not have much feeling, numbness.
Because of the nerves you talked about?
Yes.
Oh.
And also any swelling or any cut, by the way. If you see any cut or any wound, it should immediately prompt you to look after it very properly.
Thank you so much, Doctor, for that detailed elaboration. I will go to Dr. Ssekyanzi to give us other complications.
Well, thank you very much. So apart from the diabetic foot, there are quite a number of other complications for this condition, diabetes. And I think our viewers should note that there are quite a number of patients whose first presentation or the first time they get to know that they have diabetes is when actually they have had a complication. Now, like this wound, somebody could have a wound that is not healing. Somebody could have an ulcer. They try everything. They try to apply creams. They apply medicines, but the wounds are not healing. So sometimes it's always important to check out that sugar and see how it is. But apart from the diabetic foot, this condition can actually result in so many complications, starting with our very own eyes. There's a condition called diabetic retinopathy, whereby because of this too much sugar, it's going to affect some of the structures in the eyes, and it's going to result into our patient not able to see very well. we get quite a number of patients who are actually having vision problems, and we recommend that they go and be evaluated by ophthalmologists who try to find out how much of a problem is there, and they advise on what to do. Sometimes it can be as serious as them requiring to get some operations to correct some of these complications. So diabetic retinopathy is one of the commonest complications. But apart from that, because this sugar is too much and it has direct effect on the blood vessels. So blood vessels are everywhere. They are there in the brain, they are there in the stomach, they're there in the abdomen, they're there in the kidneys. So everywhere where there's a blood vessel, actually there could be a problem, because this sugar being too much, it's one of the things that causes the blood vessels to harden, what they call atherosclerosis, that hardening of blood vessels. So because of this, there are actually some other conditions for which you are at an increased risk of things like stroke. Okay, so a patient who has diabetes has an increased risk of having
getting stroke.
Yes, and then apart from that, also the heart itself, as much as the heart is this organ that pumps blood, but the heart also requires blood to be able to work. So if the blood vessels in the heart also get these problems of atherosclerosis, they harden simply because of too much sugar, they get damaged because of too much sugar, somebody is actually at an increased risk of heart problems, including things like heart attacks. So diabetics actually have an increased risk of heart attacks. That said, there's some other things like the kidneys. Okay, this sugar can affect the kidneys, resulting into a complication called diabetic nephropathy. Okay, so patients who have diabetes, usually they tend to actually get complications, especially if they're not well controlled and their sugars are quite high. I'm glad Dr. Kamara has fully told us about what happens in diabetic foot. So quite a number of complications can happen, but most of them stem from the fact that this sugar, when it's too much in the body, is going to affect the blood vessels. And the moment you affect the blood vessels, you're going to affect the way nutrients are delivered into the body, how oxygen is delivered, how waste products are removed, and this can cause problems into the whole body. Yes.
So that means that diabetes mellitus nearly hits every organ in the body.
That's it. Even things like UTIs, much as yes, UTI is an infection, but if somebody has diabetes, actually their risk of getting these UTIs are quite
why is it that someone with diabetes is at an increased risk of ending up with a UTI?
So, well, these organisms, the bacteria that cause these diseases, most of them also consume on glucose. Okay, most of them consume on glucose. So if somebody has had these sugar levels that are very high and they have damaged their kidneys, there comes a time whereby some of this glucose can even leak from the kidneys and it gets into the urine. Now this bacteria body needs this oxygen, just like body needs this glucose, just like our body cells need it. So the moment these bacteria find places that are rich in glucose, they will take up that glucose, they will feed, they will produce and multiply, and will cause things like infection. So things like infections are very common, even the fungal infection ones, because
like
you realize
candidiasis.
that yes, this diabetes, it weakens our immune system. It's one of the conditions that will put our immune system down, and it will put us at risk of many opportunistic infections. Infections which take advantage of the fact that our immunity is low. So we be at an increased risk of such conditions by virtue of having the diabetes mellitus.
Thank you so much, Dr. Ssekyanzi, for that interesting discussion. I have actually noted that if you have hazy sight, you never know. It could be retinopathy that is insinuated by diabetes, so you really need a checkup. Maybe something that I request to interest our viewers in. If someone has diabetes, like you've said that if this is a complication that is coming as a result of having diabetes, so I'm living with diabetes and I don't want to reach this step of complications. So how frequent should I visit a health worker? How frequent should I maybe test for the kidneys to find out how they are working? How frequently should I look at how frequently should I visit my ophthalmologist to see how my sight is? How frequently, if I'm living with DM, how frequently should I really go and visit those specialists to find out?
Well, thank you very much for that question. Now, for patients who have diabetes and they've had this diagnosis, like we mentioned, it's one of the chronic illnesses that you're not going to treat in one day and the next day you're okay. So it's a condition that might require you to take medication for quite a long period of time. And usually what we do in our clinics is that when we see these patients, we give them drugs that will run them for some period of time. but then we give them review dates. We can give them maybe a month or 2 months or 3 months, depending on how serious the condition is. And then after that period, you can always review them, see how their sugars has been controlled. Of course, check also their pressures and see how they have been controlled. Screen for things like infection or any of the complications that can arise. And then from that, we manage them accordingly. So we give them these periodic reviews, and from that, you can always assess and see how they are and intervene accordingly.
Okay, so how these reviews can be like weeks, months, or
so usually depending on someone's sugars and maybe any other possible comorbidities, but usually do about a month, 2 months, or 3 months.
depending on how the sugars are being
Yes,
controlled.
yes.
So after like 1 month, they come back.
Yeah, yeah.
Oh, thank you so much.
Yes.
On DOCtalk show, we always say that prevention is far, far much better than cure. So if you have diabetes, please ensure that you visit health workers, let them examine you, let them screen you for these complications, because we don't want the diabetes to exacerbate into developing complications. We are going for a short commercial break, and when we come back, we shall be talking about living with diabetes. How best can you live with diabetes safely so that it does not exacerbate into complications, because we don't want to develop complications. So let's go for a short commercial break. We shall be right back.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
Welcome back, our dear viewers. Thank you so much for keeping it only at DOCtalk Show. As we headed into the short commercial break, we are discussing the complications that people with diabetes mellitus tend to develop. And right now, we want to delve into the treatment. How best do you treat diabetes mellitus? And if you have diabetes mellitus, how best do you live your life? So we are going to go into treatment, and Dr. Kamara, the floor is yours.
One of the main pain points that is expressed by people living with diabetes is the dietary restrictions that are put on them and the lifestyle modifications. And yet, these are important to living with diabetes and managing diabetes. So managing diabetes involves some lifestyle modifications and some taking drugs, taking medication. So with the lifestyle modification, you have a diet, exercise, diet and exercise mainly, and also there is stress management. So when it comes to diet, it's advisable to take a diet that is rich in fiber and a little lower in carbohydrates. So there's a certain diet called a Mediterranean diet that was found to be quite good for helping people not to get diabetes. So it was research that's carried out. You know, medicine is based on research.
So like it's a preventive kind of modality.
Yes, when people were researching into diabetes and diet, they found that the people in the Mediterranean area were less likely to develop diabetes than people in other areas. So they went into their diet to see what kind of a diet they were taking. And that's that's where they found that the Mediterranean style diet is protective against diabetes. So now we've adopted this. We can adopt this as well. So the Mediterranean diet is mainly a diet that is, it's lower in carbohydrate foods and richer in the protein foods and rich in fiber. Okay. So we always advise, if you have diabetes, to adjust your diet, modify your diet to make it richer in fiber, a bit lower on carbohydrates, and richer in protein. So most people think that just changing one food is the solution. We often hear people telling people, stop taking sugar, stop taking milk, but just changing one food is not the answer.
What should I eat exactly?
If
you tell me to stop eating all these foods, then what should I eat?
Yes, that is a common challenge that they have. And I want to reassure you, if you have diabetes, that you don't have to stop eating all the foods. The key is in moderating the foods that you eat. So it is about looking at your diet as a whole in its entirety, and looking at your diet and making it more rich in fiber, and reducing the carbohydrate rich foods and increasing the protein rich foods. That is the diet that has been shown so far to help people, those who are prone to getting diabetes. It helps them not get diabetes, and those who are already diabetic, it will make the process of getting the complications slower. So you're less likely to develop
The
some of the complications. Yes.
Okay,
So-
maybe Dr. Kamara, also one other thing I'll add about a diet is that you realize that most of our African diet here is carbohydrate. We
Yes.
take too much of the carbohydrate, which further increases our risk for getting diabetes. Like I earlier on mentioned, usually tend to get this type 2 diabetes. And usually one of the things we recommend to our patients is that we develop what you call a diabetic plate. A plate for a diabetic person, where I usually encourage them that you divide this plate into 3 parts. Okay, whereby one half you're going basically to put vegetables and fruits. One of the quarters you just put a carbohydrate, and then the other quarter you just put protein. Okay, so by that alone, you sort of try to moderate this food so that you just eat a quarter of the carbohydrates, which directly translate into sugar, a quarter of the proteins, that's a bodybuilding food, and most of the parts of the food is actually fruits and vegetables. We really encourage our patients to do that.
It's very interesting.
Portion control is huge in managing diabetes. So, and it's a problem here because here we tend not to manage our portions, but it's very advisable to manage your food portions if you are to prevent yourself from getting diabetes, or if you're diabetic and you want to reduce your risk of getting the complications.
So you should try to adhere to a diabetic plate. So Dr. Ssekyanzi has told us that a diabetic plate, you divide the plate into 2 halves. The first half is full of fruits and vegetables.
Yes.
Then the other half, you divide it into 2.
Yes.
One half is comprised of protein foods, and then the other half is comprised of carbohydrate foods. So we shouldn't eat only matoke and maybe one sauce and that's all. So it should be a diabetic plate, especially for those people that have diabetes. And then those that have not yet developed diabetes adhere to the Mediterranean diet that Dr. Kamara talked about. Thank you so much.
Actually, it's even some people who are pre-diabetic who come to the hospital and they test you and find you're pre-diabetic. If you stick to the dietary modifications really well, there are some people that have even managed to go back to a normal state of blood glucose regulation.
And they don't continue to diabetes.
Yes, and they have not progressed to full-blown diabetes. So it's very good.
Thank you so much. Doctor, you talked about exercise as well. I don't know which exercises are recommended. There are people that run, there are people that walk. So which exact exercises are recommended among the diabetic people?
30 minutes of exercise a day is recommended if you have diabetes. So 30 minutes of exercise every day could be walking or running, any exercise you do. Tied into this is weight control as well. So you're supposed to keep your weight within a normal BMI. Yes. So the weight control is also part of this. Yes, managing your weight. Another element of lifestyle that diabetics tend to struggle with is the emotional toll it takes on you. Managing your blood glucose levels. You know, culturally, food is a big part of our culture here in Africa. And now when you have to make very many adjustments to the way you eat and when you eat, you know that the emotional toll is very hard on people. The cost, like I'd mentioned, the cost of buying medication,
buying the drugs,
the
the
cost of
food
buying,
itself that you talked about.
Yes,
These
the cost
recurrent
of,
visits.
Yes, the cost of buying the blood glucose, the glucometer to monitor your blood glucose. So all that, and also the fact that you may not be able to join your family sometimes. It becomes a challenge. During holiday seasons, diabetics struggle. Because it's Christmas, it's Easter, you first of all, you travel, and then that traveling makes you change what you're eating, it makes you change the time you eat, now you have to change your medication. So the emotional toll is huge. So stress management is also very important of the lifestyle changes. When you're diabetic, you need to look for support, look for a support system, look for knowledge. Knowledge can reduce stress. If you have the knowledge of how the complications you can get and how you get them, then you can prevent them and you will reduce your anxiety over acquiring those complications.
Thank you so much, Dr. Kamara. I request Dr. Ine to add on to what Dr. Kamara said.
Actually, I just want to take us a step back. That one of the leading drivers of diabetes currently is urbanization. Okay, as we live,
cities are developing.
yes, cities
People
are developing.
that
People are
lifestyle
moving from the
modification.
villages where they used to go and dig like chunks of land, and people are getting more passive, a little physical activity, and that because of this urbanization, somebody will wake up in the morning, sit in their car, ride to work. Then at work, they will take all these fatty foods, too much oils, too much sugar. They don't exercise, they sit the whole day, and all these calories are accumulating in the body. So the rates of obesity are rising, and obesity is one of the biggest risk factors for diabetes. So urbanization, reduced physical activity, all of them further put us at risk. That's why we encourage our viewers out there to adhere to the advice like has been given to us by Dr. Kamara of ensuring that we eat right and exercise as much as possible.
So I have diabetes.
Mm-hmm.
I've visited a health worker. I've confirmed that I have diabetes. What are those? How best do I treat myself? How best do I manage myself?
Okay, awesome. So one, after you've had the diagnosis, it's quite important that you adhere to the treatment that has been prescribed to you. Take it as being prescribed. See if you can manage the exercise routine that your body can afford. But it's not that everybody should always exercise. Sometimes with diabetes, people can have some other comorbidities. They could have heart problems as well. So it's always also important to know what kind of exercise you can do and make sure you do that, as well as observing the strict diet, plus all the other recommendations of ensuring foot care and all that. If you do those and you keep your glucose levels controlled, you will have very good outcomes.
So I always see those patients that have diabetes always injecting themselves with insulin. Others are taking medications for life. I am taking 3, I'm taking 2, I'm taking 1 type, or others are taking as much as, a good number of tablets really because of poor control. So what are those things that may risk someone to having poorly controlled diabetes? They are taking medications, but there's nothing that's coming out. Their sugars are persistently high.
One, we need to make sure that you have the right diagnosis. Now, like we mentioned, that sometimes it can be type 1, sometimes it can be type 2. So assuming you're having this type 1, whereby the body is not producing insulin, and then you're taking maybe oral medications that actually
rather
not
than
directly,
insulin.
yes. So we need to make sure that the diagnosis is rightly made. 2, after making sure that the diagnosis is right, then we make sure that we're taking the appropriate doses, and then also we put on alongside that we put things like dietary modification and exercise, and with all these, the blood sugars will always be controlled.
Thank you so much, Dr. Henry and Dr. Kamara. We have really have had a very, very good conversation on treatment and management, because usually at times people are diagnosed but they don't know what to do, or we manage them and we end up seeing the sugars remaining persistently high. So I think managing themselves even before they seek medications is really better, as per what they are supposed to do to prevent the disease from exacerbating and getting complications. To our dear viewers, thank you so much still for keeping it only at the DOCtalk show. We are heading for a very short commercial break, and when we return, we shall be discussing prevention and what puts us at risk. Thank you.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Our dear viewers, welcome back to this last segment of the DOCtalk show, and thank you so much for keeping it at the DOCtalk show. As we went in the short commercial break, we are still discussing the treatment, and we are now heading to the myths and misconceptions. We want to know what are those things that people know wrongly about diabetes. Either it's diagnosis, it's treatment, people that have diabetes, things that people wrongly know about diabetes entirely, and how best you can address them. Dr. Kamara is going to be taking us through. Over to you, Dr. Kamara.
Okay, so let's bust some myths about diabetes. So myth number 1, diabetics should not take sugar. So this is not entirely true. So sugar is diabetes, like we said, it's a medical condition where your body either is not producing insulin or cannot effectively use the insulin that it's producing. So even if you're taking, whether you take any food that contains sugar, carbohydrate-rich foods, for example, rice, Irish potatoes, posho, all those foods, contain carbohydrates, and when carbohydrates are broken down, you produce sugars. So it's not, sugar is not the culprit. It's not
the only carbohydrate
yes,
that you were eating
yes,
before.
sugar is not different from honey or other foods when it comes to your blood glucose levels. When it gets to your blood, it's all sugar. Whether it's sugar or honey, it's sugar. Your body still has a challenge with dealing with that sugar. So now, what sugar is often compared to honey. Many people, they eliminate sugar from their diet and take honey instead. So now, let me talk a bit about this. So sugar has a higher glycemic index than honey. That's true. So a higher glycemic index means that when you take sugar, your blood glucose level is going to rise at a much faster rate than if you are taking the same amount of honey. So that's what gave sugar a bad rap. That's what gave sugar a bad reputation. However, if you are looking at blood glucose control as a diabetic, you should be more concerned about your whole diet as a whole, because you may not take sugar and then you take white bread. White bread has a higher glycemic index than both honey and sugar. So you're not doing much by cutting sugar out of your diet and taking everything else. So you should look at your diet as a whole. So this myth that diabetics should not take sugar is indeed a myth. You can take sugar, but you have to take it in moderation. Whatever you take in moderation. Yes. Now I must mention here that honey, as a food itself, it has other benefits. It has some benefits. It's been known to help with fighting some infections, common colds, cough and cold, what we call upper respiratory tract infections. So as a food, it has some other advantages, and that's why people take it, and that's why I would recommend someone to take it, but not to say that it will make a difference when you're diabetic. No, it will not. You can take sugar, you just have to take it in moderation. You can take honey, but you have to take it in moderation.
Dr. Kamara, I also wonder, yes, the quality of life somebody has to live when you tell them that you're not going to take sugar. I mean, that kind of quality of life alone is not good. So it's quite important that people know this right information so that they put it to right use. Also, remember, we're going to restrict quite a number of their diets. So,
Inspiring Uganda.